Today we begin a series on mental health with Ascenda Integrated Health Services, as everyone's mental health has been challenged during the pandemic. Although we aim to find the silver lining, all ages have felt added stress for many months, so we reached out to our local experts for help. I'm Lauren Aldy, and this is your Herald Health Minute brought to you by the Cape Regional Health System. In November, the CDC Morbidity and Mortality Weekly Report published an article identifying a spike in mental health-related emergency department visits among children aged less than 18 years during the COVID-19 pandemic. To better understand the impact on children, we spoke with Jennifer Kugler, a licensed professional counselor and approved clinical supervisor and senior program director of the Behavioral Health Services of Ascenda.
Some of the trends that we're seeing with children, in their overall health and, more specifically their mental health over the last year really are some increases in, sadness and anxiety. And that really is, with our little ones all the way up through, our older adolescents. And, think about it. There's been a tremendous amount of, change, loss of structure and stability that our kids have experienced. And, with that comes isolation, whether it's those social relationships or those, academic relationships with, teachers or, special adults in their lives in the education system. Things have changed greatly for our kids. We tend to see a little bit more with our younger ones, some of those behavioral issues, almost some of that kind of acting out, not wanting to listen or, maybe throwing some additional tantrums when that's really not their typical. And with our older ones, we see more of that almost, kind of anger that's coming out from some of that sadness and, that depression that they might be experiencing, as well as that anxiety. And let's face it, this has been hard for us as adults. And, we've taken the time to learn some of the skills to address our uncomfortable feelings. For kids, they're still learning. So it's certainly been a lot for them to kind of shoulder. What we notice most and what we talk about with kids is that idea of resilience. They're actually really, really flexible at times and can adapt to changes sometimes much better than we can, as adults. But with that being said, they're obviously, still our most precious resources in the community. And we want to make sure that they're getting the support that they need, through differences and changes. And so ultimately what we've found is that some simple things can really help to alleviate some of the stress that they're feeling. So first and foremost, make sure that you're speaking as honestly, with children around you as you can in an age-appropriate way, right? You don't want them to be watching CNN, 24 hours a day and, soaking that in, but you want to tell them what's going on. You want to give them as much heads up as you can if there's going to be another change, whether it's, school changing and schedules changing again, or, we can see grandma this week, we can't see grandma this week. As much honest conversation as you can have is definitely, a positive and a step in the right direction. The other piece, make sure that you're not only, helping your kids to feel better and to use skills, but you yourself are also using those skills and you're actually demonstrating, right? Kids are sponges. Whether they're 5 or they're 16, they're watching every move that we're making, and, really at times kind of mimicking some of those things that we're doing. So if we take a break, we walk away from the technology, we, turn it off for a few moments to, take a breath. If we, take a walk or do something physical outside, bounce a ball, play some basketball, run around the yard, it doesn't have to be anything wild. It could be as simple as a bike ride. And sometimes that physical distance and that activity can kind of reset, not only us, but also, our kids. As much as we can in helping to cope through all of this is predictability. If there can be any type of routine that can be established or set or followed or talked about, that will definitely help kids to feel less anxious. When do I know it's time to kind of seek that outside support and that help? And as far as mental health goes, what we really look at is, an amount of time, right, that passes that we start to notice a difference in our kids. And that's not a one-day incident unless it's something that is really scary, right, that, you need to seek kind of emergency services for. But it's something that happens over time. So typically, a good 2 weeks, if you're starting to see your kids, or family members, children that are acting different or looking different, and things aren't getting better with some of the suggestions that we just, kind of touched on, that might be a time where you start to kind of look for outside help. Most schools at this point are really aware of the impact of mental health and have supports within the school, to at least begin that conversation. But really, your kids best, and if you're seeing that difference for an amount of time, that's usually when you want to do some of that outreach. I think the other piece is really the long-term impact, and I think we're still seeing some of that unfold, and we're going to see it more and more as things start to open up and we start to kind of come to our next phase of that new normal. And we're going to have to pay attention. Are kids struggling with academics because, the pressure is kind of on again? Or are they struggling to get back to a comfort with their social interactions because they've been so different over the last year? So I think as each phase and new normal kind of comes, we have to be prepared to take a step back and say, how do things look now? Because we're still in the process of it.
For more Herald Health and Wellness reports, visit the Cape May County Herald.com and click the Lifestyle tab. This health video has been brought to you by the Cape Regional Health System. For more information on services and for a healthier life, call 609-463-CAPE.